So in order to achieve positive impact on a substance user's well-being, early detection of the abuse is really important, along with interventions, getting in there right away. So the best possible outcome that we can hope for would, of course, be abstinence. If we can't achieve abstinence, and we don't typically do that right away, another one that we talked about, a goal, would be control or moderation. And that's more so whenever the person they want to keep using drugs. They don't want to stop. So to have Elvis do that, we kind of agreed that that wouldn't really work for him, because he doesn't fit that type of intervention. So that was kind of an unrealistic goal. A more realistic goal would be the harm reduction. And that encompasses many different approaches, and it's designed for those who just refuse treatment or they drop out. Maybe they just feel it's just too hard to accomplish and that they'll never get there, it's too much for them. And it was to address the health of the public. So examples of that would be like a needle exchange program, or like a driving, someone who's not going to be the designated driver. Or an example for one of my clients on my internship is 3 beers a day. That's all they can have, no more, no less. So that would be part of the harm reduction goal. And we really want to work with the client's stated goals. We don't want to pressure the client to change. We want to work towards abstinence, but we don't want to change their behavior. We want to work with what they want. Okay, so for the expected results from our brief interventions, we're going to incorporate motivational enhancement therapy, so meeting the client where they're at in a non-confrontational way. And that's going to help bring our social workness down to their level. We want to provide them with psychoeducation, and we want them to distinguish their goals and what they're actually doing right now that's causing problems with their substance abuse. So we want them to be able to see that. We want to make sure that they stay engaged. We want to make sure that they stay motivated. That's the end result that we want them to maintain. And we also develop a care plan that we want to stick to and check in periodically with them. And we want to explore any ambivalence that comes up throughout the process. So that would be the outcome of that. So our coping skills approach. We use harm reduction, moderation, all of these here listed. What really works well with that is the CBT. So we want to get them to address, as Matt showed in the role play there, we want them to address that dysfunctional thinking, and we want to have them come up with reasons for denial. We want to address that and show how it's not working. And we want to teach them the self-monitoring and cue exposures. We want them to notice when they're at a time when they're in an at-risk situation. And either those positive thoughts or negative thoughts, we want them to see that and self-monitor. So any situation that could enhance or hinder their sobriety, we want them to be aware of those cues. And we want to teach the social skills and stress management training. We want them to learn maybe some assertiveness when the situation comes up. Maybe a doctor is trying to prescribe drugs. So we wanted him to be assertive with his own treatment and know that that's not okay for him. And that could happen through modeling or through role-playing with the social worker. So that would be an outcome in that. Also, we want to make sure that he has sober, I can't say this right, sober social supports. Sorry about that. So the overall of this would be, we want to increase the self-efficacy, and we want to help reduce relapse in these at-risk situations. And we know there might be slip-ups, and not just Elvis, but in any treatment. But we want to be able for them to realize that relapse is not the end. That's, he's not sabotaging his treatment, that he can move forward with that and continue on for a healthier and preventative lifestyle. So outcomes of the 12-step program. So as Matt said, again, it's the disease model, and it emphasizes follow-up and continued involvement. Although social workers aren't really the ones who initiate this, it's volunteers who are also going through their own treatment as well as this. We did find that the better outcomes are for those who completed the actual 12 steps and who also incorporated things like CBT and especially coping skills training that also works really well with AA treatments. So their motto is one day at a time. So we want to approach problems, we want to prioritize. We don't want to just have them expect to just overcome everything all at once. So that's with 12-step. And how are they measured? We measure that by the patient's health status in terms of patient functioning and symptom severity. And those outcomes are included, they include 4 areas. So we want, those areas are reductions in their drug use or alcohol use, with Elvis would be drug, improving his health, improving his functioning, and also reducing the threats to safety. So it's difficult to see which intervention actually helped because we did use a multidisciplinary or a collective approach. So it's kind of hard to pinpoint which one worked. And also we need to consider the client himself. Elvis, we need to consider his lifestyle. We need to consider the fact that he has large amounts of money. So any of that could be a barrier to his treatment. And baseline level of functioning. That was established as Megan did in the assessment. So we don't want to do this when he comes in the ER because he's intoxicated at that point. So we want to administer those tests that she pointed out to you. And we want to look at his GAF score. We want to do it after detox. We want to do it during treatment and then again after treatment. And we want to gauge his level of motivation. We want to ask him, why do you even want to change? We want to assess all of that to determine what his baseline is. And we also want to make sure to check with his other collateral, his bandmates and all of that, maybe ask them, how was he functioning before he started abusing the drugs? How does he look like now and after treatment? Assess all of that again. So that's how we determine baseline before the intervention would take place. So next I'll pass it back to Julianne here.
Okay, great. So looking at now some of the legal and ethical issues that were involved in this case, we decided to kind of look at all this in a present day format because this is when we exist and this is when all these interventions are available. So just a quick illustration that if we look from the 70s until just several years ago, there's been a dramatic increase in accidental deaths due to overdose. And so we, as a team, look at some of the things that have been done since then to really focus on improving this number and decreasing accidental overdose deaths. The first thing, and maybe the most prominent, I would say in response to the deaths, would be 2 things. The Online Pharmacy Protection Act that was passed, as well as new PDMP plans. The prescription drug abuse plan is kind of a 4-fold intervention that starts with education, includes monitoring, proper medication disposal, as well as enforcement if there are violations of substance abuse. Specifically speaking to the PDMPs, and if you could go to the next slide, basically the focus of these is to prevent something called doctor shopping. So a client can go to one doctor, say, hey, my tooth is aching, as did Elvis, then go to another doctor and say, I'm having trouble sleeping, and potentially be prescribed the same exact medication by both doctors. So with the PDMP, there is a requirement for a practitioner to upload within 15 days to the site that they have prescribed this medication to a patient. It also gives them the right to access, as long as the client allows, access their history of medication to see what they're currently taking. This is used at pharmacies a lot too. A lot of times they're able to see if there is going to be a conflict in drug prescriptions. There's a lot of goals. Obviously, they want to better the standard of care, and they want to identify these doctor shoppers. The problem with this right now is that it's only per state. So in the case of Elvis, where he was on tour and traveling, going from Alabama to New York to California, unfortunately something like this wouldn't even be relevant because it's not a nationwide program, which is something that's unfortunate, but in time it looks like it would be developed. Looking at the ethical aspects,